Hello, everyone, and thank you for joining us for the second day of the ICDS Symposium, Harnessing the Data Revolution to Enhance Diversity. I'm Jenni Evans, Director of Penn State's Institute for Computational and Data Sciences and a Professor of Meteorology and Atmospheric Science. Day one of the symposium included a fantastic set of talks on issues spanning ethics, programs for increasing enrollment and success of underrepresented populations, and challenges in recruiting a diverse faculty. We'll continue yesterday's successes with some more compelling talks today. We're also looking for a few Penn Staters interested in helping to organize a follow-up workshop so that we can continue discussions exploring diversity-related research or programming that we can pursue at Penn State. In this committee, you'd be helping to set the high-level goals of the workshop in collaboration with ICDS. The ICDS events and communications teams will handle all of the workshop logistics. If you're interested, contact Susie Unger at the email address in the chat. And now I'd like to introduce Dr. Lora Weiss, Senior Vice President for Research at Penn State. In her role as Senior Vice President for Research, Dr. Weiss provides strategic, technical, and administrative leadership to advance Penn State's research enterprise. Dr. Weiss is an accomplished scientist and educator with more than 30 years of experience in higher education. Her research is focused on robotics and unmanned systems. In her role as Senior Vice President for Research, Lora is the Principal Academic and Administrative Officer for Penn State Research and oversees research of 11 academic colleges and 7 university-wide interdisciplinary research institutes, which include ICDS, the Applied Research Lab, which is a university-affiliated research center for the Department of Defense, and many offices in support of research, including sponsored programs, research protections, industry partnerships, technology transfer, and strategic initiatives, as well as the Office of Entrepreneurship and Commercialization. I may have missed a couple. Penn State consistently ranks among the nation's top 20 public research universities, with 18 of our research programs ranking in the top 10 nationally, according to NSF. In fiscal year 2020, Penn State's annual research expenditures exceeded $1 billion, and Lora's overseeing this enterprise. We're privileged to have her here today to open up day 2 of our virtual symposium. Welcome and thank you, Lora.
Thank you, Jenni, and thanks everyone for having me here today. Again, I'm Lora Weiss, Penn State's Senior Vice President for Research, and thank you for participating in day 2 of Harnessing the Data Revolution to Enhance Diversity. As you know, this event is hosted by the Institute for Computational and Data Sciences, one of the interdisciplinary research institutes that report to me, but it's also co-sponsored by the Office of the Vice Provost for Educational Equity and the Center for Social Data Analysis. As Jenni mentioned, by way of background, my background is I spent most of my career working in robotics and unmanned and autonomous systems. And in particular, the artificial intelligence and the logic that goes into these robotics. And we've all seen how even with the best technology, it can be blindsided by the lack of diversity awareness. So the importance of this conference and this workshop is that diversity really does need to, that our technology really needs to reach a broad, diverse community, not only to give other populations opportunities to succeed, but really to bring the diverse perspectives on problem solving. I'm going to take a little deviation here, Jenni, from the welcome, and I'm going to give you an example of several years ago, before I came to Penn State. I was sponsoring some research. Some people were developing a smart yoga mat. It was really meant to be used for being able to measure people's performance when they were exercising. And the team was really excited. They said, you know, here you do the push-ups, and the mat is so smart. It sees your hand position and it sees your feet position. And you go and you do the push-ups, and it can tell you how many you've done and where the pressures are on all of your hands. And they offered me the opportunity to test out the mat. And I said, sure. But I was wearing a dress at the time, so I wasn't about to do your traditional push-ups. I was going to do girl-style push-ups, where you have your hands in the two front positions, but then you have one pressure point where your knees cross and one pressure point where your toes touch the ground. But instead of those 4 pressure points creating a rectangle shape, instead it created a cross type of shape or a T type of shape. And I messed up the whole entire algorithm just because here I was, a female doing girl style push-ups. Their whole algorithm was not working. And that just shows, with a little bit of insight, a little bit of a broader team, that if they had put a female on that research team, if they had tested it out among a broader population, a more diverse population, they wouldn't have had to go back to the drawing board. So something as simple as that shows the impact and the cost. So now they have to go back, redesign. There's so many reasons why you want to increase diversity on your teams. You increase innovation, collaborations, new ideas. You will be meeting new collaborators. You'll understanding new challenges that others encounter, which will then lead you to coming up with new ideas, and you'll be invigorated to think in new directions. You'll achieve new accomplishments, and you'll make lifelong friends. So I want to thank everyone for taking this topic extremely seriously and participating in this event, and again, making lifelong friends, creating those new innovations. So thank you very much. At this point, I'd like to turn things over to Lynette Yarger, who is Associate Professor of Information Sciences and Technologies and Assistant Dean for Equity and Inclusion in the Schreyer Honors College. Thank you again for having me here today, and enjoy the rest of the presentations.
Yes, thank you for the introduction, Laura. Good afternoon, everyone. I'm Lynette Yarger, and I'm a member of the Faculty Planning Committee for this event. Yesterday's talks were very intriguing, and I'm confident today's talks will be just as thought-provoking. From Adriane Randolph, we'll hear about efforts to achieve gender equity in the ranks of data science and information systems faculty. We'll then hear how Penn State and peer institutions are compiling and using big data to understand and retain undergraduates from underrepresented groups, in a talk from Jeff Adams and David Smith. Sarah Rajtmajer will talk to us about how automated analysis of published research can be used as part of diversity efforts. Mary Murphy will then tell us how getting students in the right mindset can help both faculty and students succeed. And Cobb Payton will discuss how flaws at multiple stages of healthcare, data creation, analysis, and decision-making can propagate to AI, making poor recommendations for underserved communities. If you have questions during any of today's talks, please use the Zoom Q&A feature. We will compile those questions and ask them of the speakers during the Q&A portion of today's talk, which starts at 3 p.m. We're going to kick things off with Dr. Randolph, a professor of information systems at Kennesaw State University. Adriane is going to discuss an NSF-funded program that uses data to explore inequities among individuals who have obtained the rank of full professor in information systems. So Dr. Randolph, please get us started.
Thank you so much, Dr. Yarger. It's great to be here. Let me just share my screen. Okay, we'll confirm that you can indeed see the correct slides of presentation mode. A thumbs up for me if you don't mind, Dr. Yarger. Thank you. All right. So as mentioned, hello, I'm Dr. Adriane Randolph, and I'm a professor of information systems at Kennesaw State University, which is just north of Atlanta, Georgia, in the US. And I also direct the Brain Lab. So I look at data in a different way, that we can collect it from literally our brains in terms of electrical signals coming from that. Today, I want to share with you a project, a $1 million grant across 5 institutions, where we are exploring how we can help advance and promote more women within information technology, and in particular, information systems academia. And this is funded by the National Science Foundation, called Impact IT, increasing the participation and advancement of women in information technology. When I was reflecting, coming out of Black History Month and leading into Women's History Month, on how many other full professors like myself, so Black or African American female, exist within the United States, I literally just thought of one other person that I needed to confirm my numbers with, and she's on the panel as well today, Dr. Cobb Payton. And I thought, surely there must be more than us two. Where are they? How do we figure that out or confirm? One source would be the PhD project, which I'll explain a little bit more as an organization seeking to help diversify business professors in academia. Another is the Association for Information Systems that collects membership data, but it's hard to get to those exact numbers. And that is the focus of today's presentation, to discuss this intersectionality of data. I mean, when we zoom out, we see that 10% of full professors in information systems are women, 10%. 25% of professors overall in the field are women. So those numbers already are not as satisfying. IS women have been reporting that we're experiencing lower job satisfaction than our male counterparts. And even within the association, over 22 years of history, there have been just 2 presidents of the association that have been female. And so looking at the overall leadership, that equates to only 10% of top leadership positions within the society have been held by women. Continue digging, looking at the awards that are being given and sponsored by the association, we see 10.5%. Quoted here is the Leo Awards. So these are some of the top recognitions for leadership and service and scholarship within the field. And zooming out further across information systems, we can't really get to the granularity of data that we're seeking. There's more perhaps reported around computing science than information systems. And so we still yearn to figure out what's really going on, and then how can we make changes within information systems. Now, I invite you to zoom into the asterisk at the bottom. Of all of those stats, we don't know what the percentage is going to traditionally underrepresented groups, and that being people who are identifying as Black or African American, Latinx or Native American, for example. So this lack of intersectionality leads us to say we can't answer some of the bigger questions that we're really yearning to answer and have the level of impact that we want. Where we can't get to what are those percentages and how are they broken out? And in fact, who is even collecting the data? I mentioned an organization, the PhD project. Well, even as we look to doctoral students moving into faculty roles, we're not able to track currently to the level that we need, but the association poses an opportunity for us. And as we look at our lives, we cannot solve big issues from one single lens. There is no such thing, as famous Audre Lorde tells us, as a single issue struggle, because we certainly do not live single issue lives. So that is a guiding mantra here. So this team of 5 women across institutions, co-PI'd by Eleanor Locono, who is currently at the College of William and Mary, Lakshmi Iyer at Appalachian State University, and Elizabeth Long-Lingo, who's at Worcester Polytechnic Institute, and 2 consultants, lead consultants, myself and Michelle Carter, who is at Washington State University. Partnering with our chief body within the field of information systems, the Association for Information Systems. This is our premier group. So if you are an academic in the field, you are looking to anchor with this group. And it is across 3 regions of the world and 150 countries. In fact, there's almost 5,000 members, just of who's reported, 33% are women. And there's lots of opportunity embedded within. Special interest groups, academic colleges, affinity groups, and a number of different ways that the association supports its members and leads communication and outreach. So they are indeed leading what is right and true for the field. And with that, they are leading who is being recognized for leadership opportunities and awards. And that's additionally where our opportunity lies. Because unfortunately, as mentioned before, women within the field have been reporting out lower job satisfaction. And they're not always getting that satisfaction from their institutions. In fact, they're finding more of that through the association and through their affiliation with activities at a broader level. And when you look to opportunities to advance to the level of full professor within the rank, it is in fact establishing this broader notoriety where the association has great influence. A few years ago, the association created a diversity and inclusion standing committee, which did launch a survey to understand more about its membership. This indicates, as has initial meetings supporting this grant, that the council and the association is indeed supportive of looking to expand its impact and understand more of how it can help its membership. In partnership with the PhD project, which was founded in the mid-90s by KPMG to increase the diversity of the workplace by increasing the diversity of whom you see at the front of the classroom. This group, still in existence, does have a body associated specifically with information systems, doctoral students that are supported, and then now a faculty alumni association. There's opportunity there for collaborating on data that's being collected and understanding where some of the gaps may lie in the Association for Information Systems data. We also have other opportunities to learn from groups that have been doing this. The AWIS explain more what that acronym stands for. Association for Women in Science has instituted implicit bias training in the academic workplace. So we're able to borrow their best practices, as well as the American Association for the Advancement of Sciences, so AAAS, STEM, and I want to introduce the additional M for you. So we're most familiar with science, technology, engineering, and math, and medicine, the additional M, as their change tool for looking at reflection within organizations. So we're able to apply those methods within the society. Our goals are primarily to, one, address the lack of gender equity that we're seeing within information systems in academia. You see it bear out in the numbers. You see it bear out in the qualitative reporting. We want to increase the number of women within the field, and especially at making that transition from associate professor to full professor. And further, we want to catalyze further accountability and change in supporting women to advancement through their careers to full professor. So just a bit of timeline for the organization. In 2014, an AIS Women's Network was formed. So that's just 6 years ago. Since Special Interest Group, or SIG, for Social Inclusion had also formed, and around that issued a task force to investigate, one, inclusion of people attending conferences. This was around a bit of political changes that we were experiencing and who was having difficulty attending conferences, especially in the United States from certain countries. And so the group wanted to make sure we didn't leave anyone left out from the organization, and addressing everyone's needs to be connected, to be seen, and to present and disseminate work. This then led to the Diversity and Inclusion Standing Committee, as initiated by the association, and a statement coming out in 2018 supporting that the association did not discriminate and would not support harassment or intolerance, especially at its conferences. So now in 2020, we see its support of our efforts through the NSF Advance grant to examine more closely women within the association and within the field. So what do we hope to accomplish out of these aims? Well, we're looking to systematically assess, develop, and improve AIS policies and practices, including intersectional data collection and analysis. And this is in an effort to catalyze action and foster accountability around supporting all members' efforts to advance to full. We have a term within the assistive technology field called a curb cut effect. And that is referring to if you're ambulating around, say, a city street and noticing the curb cuts in to have the sidewalk meet the street, with the aims to allow someone who is using a wheelchair, for example, be able to traverse that terrain easily. Well, it's not just people that are using wheelchairs that use that advantage. People who are pushing strollers, who are on bicycles, if you're using that, all of us have improvements in our lives. And so that's the idea that by making advancements for one, everyone is indeed able to benefit. So the second objective is to create and institutionalize best practices and systems that support women in their paths toward full. And the third, implementing best practices in addressing implicit biases throughout the IS field. And looking at how we can involve the association with this, and this is not an initiative just being taken on by the 5 members of the grant team. This is again in partnership with the association. We have formed these 3 groups. So 1, the data group, 2, the self-assessment group, and 3, the best practices group. Members of the grant team do indeed serve on each of those groups and will serve as leading or facilitating, we'll better use that term, the conversations and discussions and practices that develop. Digging more deeply into the data group that I am chairing, we're looking to define what membership data we should be collecting. So we're starting more broadly with what do we want to find out about our members? And then to figure out, can we discover that from the existing data? So we are going to launch into an as is and to be picture around data collection. And ultimately be able to provide recommendations for what we should be collecting in light of sensitivities of protections and understanding of why are we collecting that data. So this first year, we are in the process of meeting next with our data groups. We've already had a kickoff at the major conference for the field, one of the major conferences, the International Conference for Information Systems, which happened in December. And again, met with great support from upper leadership and the Executive Council. Those members are also volunteers to serve, as you saw previously, on those different groups. So those working groups will move forward to assess practices and see where we might make changes. This work will also be evaluated by external consultants, so it will not exist in a vacuum. We will not just be touting our own work to our own people, because we hope to be able to share our findings across associations. Surely Information Systems, as we know, is not the only group experiencing similar constraints and biases towards women in its field. For example, the Society for Neuroscience has already launched an effort that we also hope to borrow best practices from. You'll be able to follow us on a related website that has already been stood up, and you'll also see findings shared with the association if you are a member. So in conclusion, I just bring you back to this unofficial mantra that we must look across and not solve from within this vacuum, appreciating that all members are interested in supporting this initiative and that they will benefit from what's discovered.
Thank you, Adriane.
My pleasure.
Yeah. Next, we have 2 speakers from Penn State. Jeff Adams is Associate Vice President and Associate Dean for Undergraduate Education, and David Smith, Associate Dean for Advising and Executive Director of the Division of Undergraduate Studies. They will be discussing two Penn State initiatives that seek to improve educational outcomes for historically marginalized students. So Jeff and Dave, the stage is all yours.
Okay, thank you, Dr. Yarger, much appreciate it. And there's David. Could you just give me the thumbs up that you can see my slides? Perfect.
I can see them, Jeff. The host has my video turned off.
Oh. Okay. Well, as they work to rectify that, you know what happened to me yesterday at Senate, so it happens. Thank you. I appreciate the time, and I will say I'm both blessed and a little humbled to be invited to talk to this group. But and I'm pleased that David was able to join me for this. We've got a lot to try to cover in 20 minutes, but I was thinking this morning about how to frame this, the sort of overall message, or at least what I hope is one of the takeaways is, I think it is important as we sort of investigate these issues, and so glad you're doing this, that we develop an attitude of more openness and sharing around institutional data that we see as a reflection of the institution. And what I mean by that is that too often we've looked at data, for instance, on achievement gaps between, say, racially marginalized groups, and we've seen that as a reflection of the students, as opposed to a reflection of us and what we're doing. And I think if we take that perspective that de-identified data is a reflection of us, we need to become more open and to sharing those data, talking about them, and then thinking through how to achieve the kind of equity that we would all that we're all working toward. At the same time, as we also think about ways that we can use data to support students, I think we have to be very mindful of some of the data security and privacy and issues that arise when you start talking about data at the individual student level. So David and I have an opportunity here to kind of present work that spans everything from kind of institutional level data all the way down to student level data. And David, do you want to say a quick word and then we'll get started?
I would echo the pleasure to be invited to this group to talk. I think it's a great honor, and I think that you framed it well, Jeff. Right? I mean, it really is trying to think about, and I think as we walk through these slides, what does data tell us about the institution, and then how do we really take that data and turn it into action, action that can affect the changes that we want to see to really close those achievement gaps. And I guess what I would go back to is really the framing comments that Dr. Weiss made about the yoga mat, right? That higher education is about solving problems in our world. And if we're going to really solve those problems, we need more eyes on those problems. We need a wider range of people thinking about this. And so these issues that I think Jeff is going to reveal in the data that we have here really help to underscore the fact that if we really want to accomplish that, then we really have to be able to find a way to take action that will begin to close these gaps that do exist in who is reaching the finishing line in higher education.
Thank you. So I've got actually two national projects that I just want to give some exposure to that Penn State is involved in that give a bit of the framework for the data sharing that we've been doing. One of them is called the American Talent Initiative. These both actually launched in spring of 2018. This is a project that focuses on a goal of admitting 50,000 additional low-income students to some of the nation's best universities, which were identified as universities that have graduation rates, 6-year graduation rates of 70% or more. So those institutions were invited to participate. About 130 or so are participating, and it's a wide range of institutions, both public and private. And then out of that initiative has also been some specific subgroups, one working on veterans, one working on community college transfer students, and one more recently focused specifically on academic equity. And actually David is one of the co-leads, along with Roderick Lee, who I know is participating right now in the academic equity strand of that work. between for underrepresented minority students, low income, and I'm a little worried I've got an internet connection problem. Is that, David, am I doing okay?
You did freeze just then, Jeff.
And if it doesn't improve, I may have to ask David to take over.
Okay. So it looks like Jeff may have frozen and have lost his internet connection. So I lost mine for a second too, so I'm not entirely sure exactly what was the last comment, but you know, these two organizations that Penn State has joined have really allowed us to look broadly across institutions that are similar to Penn State to really begin to compare and think about outcomes, data-informed outcomes, and to really begin to uncover some of the gaps and challenges that we face as institutions of higher education. Good. I'm going to pick it up. I hope it's still working. Just to give you an idea of some of the participants, and there'll be some familiar names to some of you there. I know some of those folks are out on the in the audience right now. But this has been a great group to work with to have these conversations. But data has been a big part of this, and definitely Andrew Waters from UE has. I think got continuing job security because of our participation in these, and special thanks to him for helping us out with this. This is I just want to quickly share the kinds of reports that we can get. So we make a major data contribution to ATI every year that Andrew and then colleagues from across Penn State help pull together. And then we get back reports that both give us back our own data, but also provide a context for that data in terms of participating universities. We get to select our peer comparison group in that process. You can see them listed there. And this is, I'm just sharing two examples. This gives you an idea of the, again, with a focus on low income students, the share of Pell students, Pell eligible students at the institutions. And these would be the most recent data because it takes a while to sort of pull together institutional data, get it submitted and get the reports back. And you can see that one thing they do for us is they always give us two reports, one that is Penn State as a full university and one that is only the UP data. Of course, a lot of our colleagues want to see the UP only data as part of their comparison set. So we provide both and they give us both back. And you can see that if you look at University Park only and look at our flagships comparison group, we are well behind certainly the average of roughly 20%. And in fact, we're one of the lower enrolling groups. If you take Penn State as an entire university across the Commonwealth, then of course the data look a little better, but still with lots of room to grow. We again get lots of student success data. This particularly looks at 6-year graduation rates. We also get the data back in terms of not just low income students, but also in terms of first generation students, self-identified, but I don't have the full data set to share today. But again, you see the comparison data looks the same on both sides of the ledger, and we look again at the all campus data versus the University Park data. So to me, this is one of the advantages of participating is not just sharing in the conversations, but actually contextualizing our university data against peers who are also participating. The other project that we're involved in has a lot of different data sharing, both at the level of our cluster of the Big Ten, but also most recently by all participating institutions that are providing data through the voluntary system of accountability. Now, the VSA is something that lots of institutions outside of APLU participate in, but the APLU institutions participating in this have a special, here's the screenshot, powered by Public's link within that within the data set. And it gives access to data like this. And there's some great reporting tools, and our group has just started to scratch the surface of what's available. But for instance, this is underrepresented minority 6-year graduation rates. And now looking at these BTAA peers. So you can see Penn State data along with some of our peers, and perhaps a better way to display, or slightly different way to display this, is look at the achievement gap between majority population students and the URM students
underrepresented minority students at these campuses. And you can see, for instance, that Penn State's line, which is in red, sort of bounces along, but hasn't really changed much over the last more than a decade. In sharp contrast, University of Minnesota, we see, has made a enormous reduction in that gap from 30 percentage points when the data stats start down to something like 4 percentage points today. So it's an opportunity not only to compare our data, but then learn from our colleagues how they're actually doing this and interrogate their approaches to working on that. Let's see. Within just our cluster, we also did some additional work that was not part of the full APLU set, but just the Big Ten participating institutions. And like all universities, we struggle with courses that have high DFW rates. So we decided to share these data with each other across a range of courses that we deemed were likely similar, right? We all teach a chemistry one, we all teach a principle of macroeconomics and so on. There are some courses that are large at the institutions that we don't all teach, but we were able to share these data, and you can see there's a great range across any given course. So as we start thinking about ways to, in terms of course reform efforts, improve pedagogy, this allows you to contextualize the results from any one course with colleagues whose students you think are fairly similar to us. And very appropriate to today's combination is we also broke these data out. Here we see the Pell versus non-Pell students, majority versus underrepresented minority students. We've got first generation and we've got male-female breakdowns in these data. And of course, within that, you can do further subdivisions of the crosstabs on those categories. But again, it gives you an opportunity to see how these differ across institutions. In this case, I chose Calculus 1. We did this for all of the courses. The order of institutions across the top isn't the same in this slide as it was the previous one. But again, it highlights some of the challenges that we all face and contextualizes our data. So with that, and I think that was about 10 minutes, I'm going to turn it over to David. And
thank you, Jeff.
He can nod at me when he wants me to advance the slides.
Okay, thank you, Jeff. So I think that really was a useful sort of setup for what I would like to talk about, and I would ask everyone to come back to what Jeff indicated at the outset of his comments, right? That institutional barriers exist, and that the more we can look at ourselves and try to understand those institutional barriers, the better we're going to create pathways for students to ultimately be successful and for a broader range of our students, right? To close those equity gaps that we do see. And so one of the efforts that's been underway is really to think about how do we take data and use it to be actionable, right? So we can see these gaps, we can see these problems that may exist in the curriculum, in the pedagogy, that create the barriers, that create uneven outcomes. At the same time, we want to provide outreach and support to students. And so the Division of Undergraduate Studies at Penn State, which is an enrollment unit for exploratory students, first and second year students, and we represent about 25% of all incoming students that will start in the Division of Undergraduate Studies across Penn State. And our work is really to provide academic advising, right? To counsel students, to challenge them, to help them think about these massive problems that exist in our world and how they might find disciplines and pathways that will help them find solutions or be part of the solutions to these massive problems that exist in our world. We've been partnering, though, with teaching and learning with technology here at Penn State to really begin to look at tools that will help advisors be more intentional and know when to take action to support students. And so one of these projects has been labeled or called Elevate. Jeff, you could go to the next slide. And really what I want to do then is just sort of talk about how we've taken data that's collected at the university and brought it into this platform called Elevate, and sort of talk about the ways that we as an institution are trying to use that. The ultimate goal is to build connections, to build rapport, to build a relationship with students. I think that if you look at literature on the success, academic success of students, that relationship building is a core part of what does contribute to more successful outcomes. And so if we know there are massive or at least significant challenges and barriers that affect students, how do we begin to sort of make data usable or actionable to help foster those relationships that we think are central to the success of students? So I will talk us through this. At Penn State, I think one of the things that we're really thinking about is a success network, right? That there are many people across the university that are really vested in the positive outcomes of our students. A lot of it starts in the classroom, right? That our instructors across the university see students on a regular basis, understand what challenges they might be facing, whether they're engaged or not. And so, a lot of this is reliant on that connection back to the classroom and our instructors. But then with their insight, we can activate a broader success network that can bring attention and help to students, right? So it sort of, in my mind, goes back to what Dr. Randolph mentioned too, right? That this isn't a single issue struggle, right? There's not just a single solution to this, but there are many different factors that are at play. And so as much as we don't want to sort of say that it is the student that needs fixed, right? In this idea that the barriers are really institutionally driven in many cases, we do want to provide that human connection, right? Because it is the interaction between individuals that can foster the relationships and build the sort of sense of belonging that is so important to positive outcomes in higher education. So Elevate is a web-based prototype that TLT has been building, and then we've really been working with them in the space of academic advising. What Elevate specifically does is that it collects activity data in our LMS, our learning management system, which is Canvas at Penn State. So by looking at a student's Canvas activity, and then sort of aggregating that so that there's sort of a fictional, like the average student, how much activity is the average student demonstrating inside a Canvas course, so that you can see individual students who may be declining or who have not engaged at all with the material in those courses. And the real goal here is not to sort of watch and monitor students, but to give advisors a notice of when to do outreach, right? When do we begin to reach out to students? How do we know that? How do we begin to offer the support and guidance that the support network can provide to students? So this is where we're at in terms of developing Elevate and really using large data to help us understand where and when to take action. So next slide, John. So this, I think what also is fueling this is really some conversations within the advising community around ethical uses of data. Training is a really critical component of this. How do we understand what data tells us, what it doesn't tell us, and how do we ultimately ensure privacy? And so really working closely with the university's privacy office has been important. So this is just a quick view of what an advisor might see in Elevate to help them understand where and when to start doing outreach to students. And there's a variety of things that we can use this for, but in the moment, it's really being used to sort of activate the advisor's outreach and offer of support. But you can see the blue line on this graph is really this fictional average student usage inside of Canvas. And the red line would be the individual student. So as you get out to March 24th, March 31st, you begin to see that this student has really stopped all activity in the course, where there's still a fairly high level amongst the average users of that. And so this has been really helpful in being proactive and providing timely outreach that really helps students to better understand what their options are at any given time, what resources exist, all with the eye towards how do we really begin to use advising as part of the effort to begin to close these achievement gaps that exist in higher education. So I think the next slide, Jeff.
I think that is just,
That
brings us to the end.
So that gives us, I think, an overview of really the sense of like, how do we use data to look at the macro challenges that we face in higher education at Penn State and other institutions? But then how do we also take data and really try to make it actionable to support positive outcomes and improvement in outcomes for students at our institutions?
So thank you. Our next speaker is Sarah Rajtmajer, an assistant professor in information sciences and technology and a faculty associate of the Rock Ethics Institute. Sarah will share about her work related to computational approaches to extract and evaluate publication data, and also touch on a new collaboration at Penn State with the NSF National Center for Engineering Statistics. So Sarah, I'll let you take it from here.
Thanks so much. Let me go ahead and share my screen. So the title of my talk is Science of Science, since meta science seems to have fallen out of favor for this kind of work. Big data and AI for understanding the research ecosystem. And my focus of the talk will be on two different projects. One is much more mature, and that's a DARPA-funded effort across 4 sites developing AI to critically evaluate scholarly work. And then a new program with the National Science Foundation Center for Engineering Statistics that might have the ability to use some of the SCORE tool, the DARPA tools, and we're looking to answer policy-related questions, including questions about enhancing diversity. So the first bullet, the work on automating our understanding of the scholarly record, was to at least some extent motivated by the recent reproducibility crisis. Well, now I guess it's a good almost 1 decade of sort of trying to manage this revelation that a lot of work in the literature has trouble replicating. And this started with a 2015 paper in Science where the Open Science Collaboration attempted to replicate 100 famous results from psychology, and were only sort of able to replicate about 30% of those results. And those were very reputable papers in very reputable journals. But since 2015, this sort of revelation and this crisis has extended far beyond psychology. And in fact, psychology has been sort of amongst the best at trying to mitigate and move forward proactively and productively from this crisis. So looking forward, the vision is to move to more modern, more interpretable, more credible representations of scholarship in the age of data. And I'm sort of very personally motivated by the ideas of David Donahoe and Victoria Stodden at Stanford, who have in a way argued that we need to sort of blow the whole thing up, that a paper as it is written and published as a PDF in a journal or in a conference is just an advertising of the scholarship and is not fundamentally scholarship. That computational empirical science as it is practiced today generates knowledge that is not verifiable, and therefore leaning on Merton's norms and other more philosophical versions of scholarship in science is not even science. So the data, the code, and the entire workflow is really the scholarship itself. And so that vision moves us toward sort of a more, maybe a more productive way, an efficient way of generating science moving forward. But that, and there's so much great effort in improving for example, pre-registration and registered reports, and just thinking about how we should be doing science in the future. But it still leaves us with all the science that we have thus far, and trying to make sense of it. And there have been a number of automated tools that try to do this. There was something that PubMed put out that tried to assign a score to papers in PubMed and say how reproducible they were, and it actually ended up being very controversial and was taken down. There's other tools like StatCheck that can ingest a paper and tell you if like the statistical analyses were valid. Those tools are also really flawed. And then there have been some sort of meta efforts, including this one high-profile effort in 2015 to engage researchers in creative assemblies of experts, in this case, a prediction market, to try to evaluate some of the papers that are sitting in our scholarly record. At this point, in around 2018, I guess, DARPA put out a call for proposals through a program called SCORE, Systematizing Confidence in Open Research and Evidence. And in very classic DARPA fashion, they decided they want an AI that can ingest a paper and then basically spit out like a very user-friendly reproducibility and replicability score, and an explanation. So grade a paper, and they were focused in particular on social and behavioral science. And what's really cool about the way that they envisioned the program is that they recruited teams that would sort of work together in their own little SCORE ecosystem. So the task one teams are reproducing studies, like on the ground, reaching out to researchers and rerunning their studies. The task two teams are like hordes of experts, running focus groups and surveys and workshops at conferences to try to understand how researchers evaluate scholarly work. And then the algorithms folks, and that includes our team at Penn State, which are creating AI that can sort of use the TA1 and TA2 data as training data and evaluation data, and then develop machine learning approaches to do this in an automated fashion. Our effort in particular uses synthetic prediction markets. So motivated by the one study I showed a few slides back, that experts are really good in the context of prediction markets at understanding what credible science really is, we decided to develop bot traders that actually learn and grow in the presence of human traders, and essentially buy contracts in or shares in particular research claims after having, in an automated fashion, read this paper. And then the value of the claim at the end of the market is essentially our confidence in that claim. So we are now 1 year in on a 3-year effort, and we have a prototype system in place. So theoretically, you can give us a PDF of a paper, and we run it through a pretty sophisticated feature extraction pipeline. And this is actually probably the most challenging part of the effort, is to extract meaningful features from papers. So of course, first pass, we get the authors, we get the number of citations and H indexes and all the usual metrics, but ideally we want to move beyond those metrics and be able to evaluate science based on what's inside the paper. So we do that with sort of ingesting statistical information from the papers, and now moving toward sort of more sophisticated features. We give all that information that we've extracted from the paper to our bot traders, and they engage in a market, and they decide to purchase assets that represent that the paper will reproduce or not reproduce. And again, the score at the end for a given research claim is our confidence that it would reproduce if that study was run again. The output of our system is a confidence score as well as an explanation. And I actually think that the explanations are probably the most critical in thinking about ways that these type of tools, maybe not our tool, but these type of tools could be used to foster a more inclusive and a more unbiased view of the scholarly literature. And there was a paper that I was not involved with at all, but I found really motivating very recently in PNAS that determined that underrepresented students innovate at a higher rate than majority students, but that their novel contributions are discounted and less likely to earn them academic positions. And I think one of the reasons this was so motivating to me is because when we think about ways of re-examining scholarship and maybe the opportunities for big data to play a role in that, we would hope that those tools would be able to mitigate some of what is going on in terms of undervaluing scholarship and inherent biases. So as I sort of alluded to while I was describing our effort, a large part of this is just taking scholarly work and extracting information from it. And this is sort of some of the things we're extracting now. And these are some of the things we're working on. So we're in phase 2. So we are extracting references to theories from papers, a lot of statistical information about the analyses that are run, characteristics of the study, the community response to work. So when that work is mentioned in another paper as a citation, how is it mentioned? And then ultimately, we're working to tie together multiple claims in a paper and understand their relationship as well. And so amongst the features that we already extract include sort of good research practices. Was the study pre-registered? Was code shared? Was data shared? And so on. So given all of the feature extraction effort, we approached the NSF National Center for Science and Engineering Statistics through one of their broad agency announcements, asking essentially for researchers to help them sort of make sense of some of the amazing data that they collect. So the NCSES, as one of its primary mission, runs a couple of surveys annually and biannually. Them is the survey of doctorate recipients. And you actually can get an anonymized version of this, or a subset and anonymized set of this survey if you go on their website. This SDR, the survey of doctorate recipients in 2017, it's done every 2 years. So it was also done in 2019, but that one is not on their website. Surveyed 125,000 PhD holding individuals and asked them very sensitive questions. So there's demographic information, education history, employment status, occupation, and so on. This very rich data that they collect. And what they want to do is try to use, of course, this survey data to better understand how to move forward, how to improve the research ecosystem, and how to, ultimately, I think, manage their funding as well. If you go to the website, you can look at a lot of the related products and the publications around this data, as well as look at the data itself. One of the sections of the related products page is a section highlighting relevance to women, minorities, and persons with disabilities in the survey. And you can click on that and see some of the reports that they have. And so this is all really motivating. It's really great that they're collecting this data. What we would like to do is join this data with some of the bibliometric data. So these reports are on the survey itself. But what if we could link the individuals in the survey with the papers that they're writing, the patents that they're getting, and the rest of the scientific ecosystem to better understand the trajectory of these individuals beyond the survey itself? And so that's sort of what the NCSES is hoping for, and what our program, which just kicked off about 6 weeks ago, plans to do. So our project, Visualizing and Enhancing the statistics of publication information under dynamics, VESPID, will integrate the SDR survey data with the bibliometric data using some of the SCORE tools. So we'll be ingesting scientific publication databases as well as auxiliary data, even social media data, with the NCSES doctoral recipient survey, as well as another survey called the Survey of Earned Doctorates that the NSF holds. And because we're operating with a private version of the data, we'll actually be able to link names which aren't available in the public version of the data set in order to follow researchers through their academic trajectories and understand their scholarly outputs, understand how their scholarly outputs and their collaborations through co-authorship networks ultimately impact their career path, and even adding patent information and other industry indicators to determine those academics who do leave or who do convert their research into to patents. So, you know, at the first level, we'll be developing some ways for the NSF and CSES to visualize and query the survey data in conjunction with bibliometric data. And so we're hoping to do this in a way that they can also then understand, for example, whether an individual had a particular impact in the emergence of a new field, or what happens right before a big breakthrough. And those kinds of questions we hope will be more clear when we're able to aggregate intelligently all of this data across multiple sources. But then the wider aim of the program really is to then inform, and this is through looking at historical traces and through simulation on future events that might intervene in the system, what kinds of interventions might help support a more equitable research ecosystem. What are the career models for underrepresented PhD recipients? And I personally think bringing in some of what we're doing with the DARPA SCORE program and being able to explain what are the signals of credibility in research, what are the signals of good scholarship, what is the signal of a novel piece of scholarship. And so I guess I sort of didn't really bring this out, but when I was discussing the DARPA project, but DARPA's really main focus, and even more important than the score itself that we output for a paper, is the explanation. And I think that those explanations are really the critical piece in understanding how we see science, how we evaluate science and scholars within this context. And so we do hope that by putting together some of the AI and the big data, the tools that we're developing through the DARPA program, and now the ability to interact with the really rich, unique survey data that the NSF collects, we'll be able to answer some of the policy-related questions on this field, on this slide, pardon me, and then lay the foundation for more focused questions about particular groups and particular interventions that might help moving forward. So with that, I'll just conclude sort of with my two take-home messages for the community. One, that a fundamental overhaul in the way we interpret and evaluate scholarship, which we know is necessary for many reasons, but those overhauls should target reducing bias in the research ecosystem, both for the sake of equity and inclusion and for the sake of efficiency and for the sake of the science itself. And this overhaul can leverage advances in big data and AI, and I hope we're starting to develop some of the tools that can do that. So thank you, and I'm always happy to follow up if you have questions or thoughts or anything like that.
Next, we have our last speaker, Dr. Payton. Faye is a professor of information technology and business analytics at North Carolina State University. And today she'll be discussing her research that deals with AI-supported healthcare decision-making and how to ensure health equity. So Faye, the floor is all yours.
Thanks, Lynette. Thanks for having me. So I titled my talk as to stop blaming the data and issues around health equity in the age of AI. So I have to put this disclaimer out here that these are my opinions. This is the research that have been produced. These are not the opinions of the National Science Foundation or the opinions of NC State or any other affiliates. This is clearly just about the work that has research that has been done. So I want to start with this. And I want to start with a story. A colleague of mine who is in engineering, we both do a lot of healthcare research together. We were ecstatic when we were able to get a hold of some real data. And so we had the Captain Picard moment. It's like, we got data, we got data. And I'm sure everyone on the call can kind of remember when Oprah said, you have a car, you have a car, and you have a car. And we thought, we have data, data, data. So now we can go about the business of analyzing that data and coming up with some models and perhaps some meaningful conclusions in the healthcare space. Well, what we started out with, and we used some HCUP data, which is available on a government website. We published a paper that was entitled Diabetes and the Hospitalized Patient. And there were 4 of us, a medical doc, a doctoral student, and 2 professors. And we marched down this road to take a look at this data over a longitudinal perspective. We did not want to have one episodic year or even 2 years. We thought if we got multiple years of data, we'd be set and we have our research agenda all lined up. So we sought to take a look at diabetes, and one may ask, why diabetes? Well, we were particularly interested in health disparities, and those health disparities are defined by the Center for Disease Control, and Prevention. And diabetes is in fact one of the chronic health conditions, health disparity conditions. So we started out with this data set, and we thought, oh wow, we got 5-6 years of data. This has got to be great. It's patient intake data. And we started out with, you can see, over 47 million discharge records. And we were like, we're on our way. We have a lot to prove. Our research agendas are set. By the time we began to filter out everyone that's under 18, we weren't particularly interested in newborns. We factored those out. That then began to leave us to 35 million. And then we said, okay, within those 35 million, I want everyone to take a look. We had nearly 7 million discharges. So if you can think of this data set, it had probably about 35 to 40 attributes, and an attribute in there included things like age and gender and race and total charges, length of stay, discharge. 7 million discharges with missing values. 7 million. So we put those aside and we did our analysis on the 28 million. So we went from 47 down to 28 million records that we could actually use. And I will come back to this nearly 7 million because we did nothing with that. Okay, so hold that for just a minute. What our paper took a look at, really coming up with a representation between the variables that we were interested in, namely chronic medical condition, sex, race, ethnicity, length of stay, total charges that a patient would incur, and then the disposition, right? The disposition meaning where was the patient, what was the condition once the patient was released, if released from the hospital. The population of interest was then separated, and we sort of said in this light gray, the light gray primary interest, we wanted to take a look at now, not just one disease episode, diabetes or not diabetes, we wanted to look at comorbidities, because when we're talking about diversifying race and doing data science, oftentimes with certain populations, and in many populations, there are comorbid conditions. In other words, the ability for one disease to show up in someone the same time that another one does. So we wanted to see what was that like. We took a look at the gray intersection, which are the demographic variables, and then our primary interest in outcome variables are on the outer ring. What we did is we used, and what we found using principal components and GML models, or general linear models. We did structural analysis, and we took a look at and found that the principal reason for hospitalization, that the disparities, of course, they were outcomes for women and ethnic groups that persisted over that time period from 2006 to 2007. Not a surprise at all, I don't think, to anyone. The ethnic groups have poor outcomes and are less likely to have routine discharges. In other words, when the person gets out of the hospital, where does he or she go? And routine typically means they may be dismissed to the home, they may go to another treatment center, there may be death. So different places, and there is actually a schema for where these persons may go. But what we learned is that ethnic groups that have poor outcomes, they are less likely to have routine discharges because the severity of the disease is just that significant. The disparities persisted over time when we looked from year to year. And we said they persisted particularly for women and women in diverse groups. And the outcomes we found were not likely to change because the length of stay may have been shorter, but the cost of care may have been higher, or vice versa. The differential impacts of diabetes on physiology and treatment of women versus men, we thought because of those outcomes, we needed to take a look at from year to year. Our goal, I should say to everyone, was to be able to trace patient X throughout the body of the data set over the years for any particular hospital. We're going to talk about that and why we were unable to do that. Homogeneity in patients with comorbidities is rare. However, what we learned from the data set was that, unfortunately, it was perhaps the same treatment plan without considering the comorbidities or the social economic factors or social determinants of health that went into that affected the patient population. So then we did this study. We said, okay, similarly as we looked at diabetes, we wanted to look particularly, what we saw was a big uptick in mental disorders. And we particularly were interested in how does mental health cling to the health disparity of HIV. Again, wanting to look at patient length of stay and what's the impact on cost of care. So I want everyone to take a look here for just a minute. The results of the principal component analysis. Let me say, when we first got this data set, again, we were wanting to be able to trace either disease episodes over that 5 or 6 year period of time, or be able to track patients over that 5 or 6 year period of time. What we found is the coding schema changed. So all of these are actually codes in ICD-9, ICD-10, codes as listed here. And it was a struggle because that coding in and of itself was causing a lot of variability and the inability to track these conditions within the data set. But we took a look at and came up with and collapsed mental health around these conditions as defined by the ICD-9 codes at the time. We took a look at non-dependent abuse of drugs, drug dependency. As you can see, all of these that are in bold here, that went into our model. Everything from schizophrenia to alcoholic abuse, alcohol dependency, anxiety, episodic mood disorders, and the like. When we did this, what we learned is that the length of stay and the comorbidity conditions affected the HIV patients. So imagine if you're an HIV patient and you go in, doctor may see HIV, but they may not necessarily see or may not talk about the mental disorder. So what gets treatment is always the question. Mental disorders generally resulted in a decrease in both the length of stay and the total charges from our results. Really surprising, like the mental disorders. And as we think about this now, this is an older study, as we think about this now in 2021 real time, mental disorders and mental health is really top of mind for everyone, especially in a COVID-19 environment. Patients with mental illness were more likely to be transferred to other facilities. So their true length of stay was not really observed. So you transfer those patients to another facility, to an outpatient clinic, perhaps to the home. But we didn't get an idea of the true length of stay while they were under care. The most important conditions that we found in our set when we did the structural analysis was drug-related mental disorders. These are the numbers that you see that were actually in the codes. And what we found is that health services delivery approaches to adherence and treatment were better address chronic disease illnesses if we take into account comorbid conditions and their severity. And normally the model would only focus on one condition or the other, but not both. So we may ask this question even going further. So Lynette, this may look a little familiar, right? So instead of using sort of your mathematical based data science models, what Lynette and I did was we wanted to take a look at how did mental health play out from a more natural language processing approach. And in this approach, building a corpus on the literature to see how did this play out in college students. This method using natural language approaches means using sort of text mining approaches. And we found out that a number of points around services at the institution for students was very important. And this was, again, a few years ago. You can imagine what the need for the services may be like at this point. We also found that race, even then, this is about 3 or 4 years ago, that race and racial factors really mattered in the medical and mental health of college students. Remember, we got data, we got data, we got data. And so we were happy, but the fact that we had data, particularly from the first 2 studies. The H-cup data, but there was something missing. There were pieces of the puzzle that were really missing because the topic of this symposium is about diversity in the data sciences. Am I correct? Okay. One thing that was not modeled in those data sets that were critical are the social determinants of health. The social determinants of health, because while it may be a data problem, it's not all about the actual data that you have in the data set. And the question of what is missing is really important and drives what the implications are. Particularly, we were interested in getting to policymakers. So social determinants of health being the economic stability, the education, of course, the healthcare system, the neighborhood and the environment for which the population lives, and the social and community context. Now, this is from Healthy People 2020. Healthy People 2020 said discrimination is a key factor. And if it's a key factor, one would think that it would be in those data sets, or there's some way to measure that in a healthcare context. What we also learned is that this is from the Washington Post. And I think part of the path that Lynette and I went down when it came to the natural language processing piece, as we said, it's not just a data issue. This is from the Washington Post, and it says, it's time for small data. In other words, big data was supposed to fix education. It's supposed to fix a lot of things. You can fill in the blank on what big data was supposed to fix, but it didn't. And it might be time to consider some of the elements of small data and of context that are really important in understanding healthcare issues. So for us, part of that was some research, again, that Lynette and I and other students had worked on to take a look at how do you build something, an artifact, an experience that is user-driven, that provides a communication tool to meet patients or people where they are. And so what that looks like is something that we worked on at My Health Impact around engaging Black college students around the idea of mental health. They told us mental health. We listened. We started out in the HIV space, and we started in the HIV space, and the students immediately said to us, I won't say immediately, but from the data, we combed through the qualitative data, and the students said, we need some help with mental health. We need help. And so we pivoted. And if we had been on the big data side, we would have missed the experience and the knowledge that the students wanted to hear about. Those papers are published in JAMIA if anyone is interested in seeing those, as well as internet research and a number of other articles, journals that are listed there. What I've come to find is what else is missing from part of the puzzle? We said small data. The other piece that was missing from the data that we did on the comorbid conditions, the historical context. Now, please don't hit me on the he here. It could be she or he, right? But the historical context of where the data and how its context takes effect. And that historical context says we need to think about the period for which we're trying to tell the story. And particularly when we're talking about Black and Brown communities, it's not enough to say, okay, they have type 2 diabetes. What is the historical perspective? Are they living in a food desert? What's the quality of the food? Is there a transportation system? So historical context really matters. We know that it matters in healthcare. It's not just a data problem, because we know that these are two major stories. COVID-19, what those numbers look like. And this may be a surprise to some, but this is a New York Times article on why Black women and babies are in a life or death crisis that talks about the lived experience of being a Black woman and being pregnant in this country, when there are more Black babies dying in birth. And what are the complications associated with that? Many may know the experience of Serena Williams, That is not an unusual experience for many Black women. We know the experience of the Navajo Nation when COVID particularly began. When we talk about, in the article highlights in Science, the journal is Science magazine or Science journal, running water, sparse internet, high rates of chronic illness. So as we are interpreting the data, we have to remember the context of the lived experience. One of the other things that is critical to this conversation is, what do data scientists look like? Who are we preparing to be data scientists? This is taken from Forbes magazine that talked about where are the data scientists, who is participating. But we have these data sets, and I'm just using in the context of healthcare, less than 4% at the time of this screenshot, right, are actually data scientists when we're talking about race and ethnicity for students by courses. So we have a participation problem in the data science space. So what I'm saying to you in part is that it's not just a data issue. As we know, there are more different types of biases. And here we go again, Lynette, right? There's association bias that exists. There's automation bias that happens within the system. There's interaction bias. There's confirmation bias. There are lots of biases that take place. So it's not singularly just the data. The data warrants that we address algorithmic bias, and a lot of people are calling it fairness and a lot of other acronyms. This picture captures the need for small data. What are the social determinants of health? The place and space context for the population that is being addressed. There is an ecosystem thinking. It's not just the healthcare piece. Healthcare is a symptom of the educational system, the justice system, the employment system, all of those for which we live, work, and play. And the context, how do we interpret those results really matter. But the data sanitation is critical. There are issues with training data, issues with the validation data, and then issues with the test data. Oftentimes, there is some overfitting, there is some underfitting. In the context of healthcare, that means populations of color oftentimes do not receive the medical service and attention that they need. That is fact. That has been documented in Science magazine and by many others in the healthcare community. One challenge here is to use design justice and center race at the center of design when we're looking at these systems. And so while algorithms may be well-intended, as ours was, right? It was well-intended to find out about who's being affected and infected by the conditions that we sought after to study. When race is excluded, the algorithms may be well-intended, but race blind only heightens the disparate conditions and experiences and outcomes. When it's race blinded, you only heighten the structural inequities. And I underline, not the individual level, but really the structural inequities. And when healthcare costs are used as a proxy for needs, oftentimes, and this was documented by these authors in Science, that Black patients actually have a lower level of need, which means that they're often excluded from receiving the healthcare that they need. So why is diversity important in data science? These are but some reasons. And few years ago, Time Magazine came out with its health innovation issue and asked a burning question: who gets to be healthy? And that is a fundamental question of who gets to be healthy. And so with that, I hope I didn't go over my 20 minutes. This is how you contact me, and I will turn it over to you, Lynette.
Thank you so much, Faye. Really appreciate it. So with the conclusion of the presentations here, I'd like to reintroduce Jenni Evans, who is the director of the Institute for Computational and Data Sciences here at Penn State. And she's also professor of meteorology and atmospheric science. So Jenni, I'll hand it over to you.
Sorry about that. Okay, thank you so much for those wonderful talks. And I was going to show you some information about the workshop that I mentioned this morning, but I can't manage to find the document. So I'm going to go on now and introduce our speaker. So I have the pleasure of introducing Dr. Kathy Bieschke, Penn State's Vice Provost for Faculty Affairs. As Vice Provost for Faculty Affairs, Dr. Bieschke focuses on faculty development, leadership training, and other issues. It's not my day. Related to academic personnel, all of which ultimately have substantial impacts on student success at Penn State. Working closely with Provost Jones, Dr. Bieschke helps to drive the achievements of thousands of faculty and nearly 100,000 students Penn State-wide. Dr. Bieschke is a former department head in the College of Education and professor of education in counseling psychology, and has worked at Penn State for more than 25 years. As a licensed psychologist in the Commonwealth of Pennsylvania, her dedication to and accomplishment in the field are widely recognized. For example, Dr. Bieschke received the Lifetime Contribution to Education and Training in Counseling Psychology Award from the Council of Counseling Psychology Training Programs, as well as the Outstanding Service Award from Penn State's Commission on Lesbian, Gay, Bisexual, Transgender, and Queer Equity. Among Dr. Bieschke's many professional interests, she's committed to enhancing the availability and delivery of mental health services to college students from underrepresented populations. Prior to moving into her current position, Kathy was involved with the Penn State-based Center for Collegiate Mental Health, which compiles critical data about the mental health of today's college students, information that ultimately influences policy decisions designed to ensure that learners get the care and support they need. Dr. Bieschke invests considerable time to support our large, diverse community of faculty and students. We are thrilled that the Vice Provost is here today to say a few words. Please join me in welcoming Dr. Kathy Bieschke. Thank you, Kathy.
Thank you, Jenni, for that kind introduction, and good afternoon, everyone. I'm here on behalf of the university to thank you for the opportunity to participate in this special ICDS symposium focused on the intersection of data science and diversity, as well as the opportunities to use data to advance diversity, equity, and inclusion in academia, all things that are dear to my heart. I also want to thank Jenni and everyone involved with our Institute for Computational and Data Sciences for hosting this event, as well as its co-sponsors, the Office of the Vice Provost for Educational Equity and the Center for Social Data Analytics for their support. And I want to thank all of you for attending the symposium. Your efforts will facilitate new collaborations and impactful cutting-edge approaches to support and grow diversity, not only at Penn State, but also across the US in higher education. So as Penn State's computational research hub, the ICDS is more integral than ever before to our research enterprise, which I think everyone probably now exceeds 1 billion in annual expenditures. And rapid advances in high performance computing are enabling us to take big data and make positive impacts in countless areas of daily life: energy, communications, medicine, as we just heard, infrastructure, finance, manufacturing, among others. And of course, one of the others is diversity. At Penn State, we believe that the power of computational research will create positive social impacts in all of these areas, including diversity. I think everyone knows that when Penn State, when President Eric Barron first began in 2014, he mapped out 6 presidential imperatives for Penn State to be a truly modern university, one of which was called diversity and demographics. And since then, Penn State's commitment to diversity, equity, and inclusion has become a moral, educational, and business imperative across the university. You might be interested to know that learners from underrepresented groups represent 13.6% of the Penn State student population, up 3.8%, close to 4% since 2018. And this trend will continue, and the university is focused on educating students of all backgrounds and achieving its institutional goals and fostering a welcoming and inclusive campus community through a variety of means. You might know that in conjunction with these efforts, Penn State integrated the framework to foster diversity into the university-wide strategic plan as one of its 6 foundations. And we published the Penn State Statement on Diversity, Equity, and Inclusion to make clear what our intentions here are, as well as our responsibilities. Last June, President Barron announced a plan to address racism, bias, and community safety as part of a commitment to make changes across the entire university in response to national events. And since then, students, faculty, and staff have just responded in amazing ways, submitting a series of proposals through the Select Penn State Presidential Commission on Racism, Bias, and Community Safety. In fact, they received a plan to implement bias training for all employees. And they've also led efforts to review and revise the Student Code of Conduct. The Faculty Senate is doing its part in considering racism and bias coursework for all students, and the Policing Communities of Color Task Force has been reconvened. In the recent year or so, Penn State has established 67 equity scholarships totaling $23 million to recruit and retain students whose gender, race, ethnic, cultural, or national background contribute to the diversity of the student body. So we're clearly doing a lot of work in this space, but how and where do data science and high performance computing come in? And I think the answer is pretty much everywhere. During the past 2 days, you've discussed the ethical challenges of using data science to inform interventions, reforms in the hiring and retention of women in academia, and data science approaches to increase the enrollment and graduation of students, particularly those from underrepresented groups. You've also learned how many colleges and universities, including Penn State, are using data to inform innovative approaches for increasing diversity, the importance of growth mindsets for student success, and considerations for ensuring health equity. I'm just delighted and proud that Penn State and its people are so invested in exploring and working with big data to address diversity-related issues. I mean, certainly that was the intent of the Center for Collegiate Mental Health, was to capitalize on data, lots of data from across the country, to inform how we provided services to underrepresented groups. But bringing together a community of experts like yourselves through events like this is only one example of our commitment to this. I thank you again for taking part in this symposium and for working together to make a difference at Penn State in regard to diversity, equity, and inclusion. I just really appreciate all of the time you've spent trying to learn from one another. So what I'd like to do now is hand things over to Amulya Yadav, the PNC Technologies Career Development Assistant Professor in the College of Information Sciences and Technology. Amulya will lead a panel discussion with some of today's speakers. Thank you.
Thank you, Kathleen. Thank you so much. Well, good afternoon, everyone. I'm Amulya Yadav, and it is my great honor to be able to moderate this 30-minute panel discussion with all our wonderful panelists. So panelists, if I can please request you to turn on your camera so that it feels like a panel to all the attendees. Thank you. So I'm going to be asking questions to each one of you. And in order to make sure that we can get to as many questions as we can that have been sent in, I request you to please keep your responses to 2 to 3 minutes per response. I mean, we can go over, I mean, if the question demands it, but let's try to be slightly concise. And if we do finish all the questions, then I'll let you all free at the end, right? And to all the participants, thank you so much for sending in all your wonderful questions. If you do have any follow-up questions, please feel free to send them in through the Q&A feature in Zoom. I know you've already sent some in, and many of them have already been answered by the panelists. If you have more, please feel free to send them in, and we'll try to get as many as we can, right? All right, so with that being said, let's get started. The first question that I have is for Mary. We've received several questions about the work that you presented, Mary. Everybody's saying that you have really interesting results, but I guess the one common denominator across all the questions that we've received is that how do you control in the results that you showed? How do you control for confounding factors that we may not have, we may not be observing? And I can point to 2 particular confounding factors that people pointed out to. One was that in the results in which you showed that people who the gap between URM students versus non-URM students in courses that were offered by faculty who had a growth mindset was lesser as compared to courses that were offered by faculty members who had a fixed mindset. Is it possible that that was happening due to self-selection biases? Because a priori, because of things like ratemyprofessor.com and these websites, students already have some preconceived notion about whether this professor is helpful or it's not, they're not helpful.
Sure.
And with these biases may, can there be a situation where because of these biases, hardworking URM students are more likely to enroll in courses that are offered by faculty with a growth mindset as opposed to a fixed mindset? So that was one of the, one confounding factor.
Sure, I can speak to some of this. So in the Science Advances paper, we not only collected the mindset of faculty from faculty, we also collected a lot of other demographic data that you would want to control for to be able to isolate the effect of their mindset on the achievement gaps observed in their classes. So for example, we collected faculty's gender, faculty's race and ethnicity. We collected how many years they'd been teaching in higher education. We collected the prestige of their PhD institution because we think that this might be socialized and fixed mindset cultures might be particularly strong. I won't name the institutions where I think it's particularly strong, but in some of these very prestigious institutions, there's a motivated belief that you either have it or you don't. And so we controlled in all of our analyses for that, but then we also looked at whether or not there were differences by faculty mindset in these different groups. And in fact, we didn't find evidence for that. It's not that women have more growth mindsets, men have more fixed mindsets, faculty who've been teaching longer. The young faculty have as many fixed mindset as do the older faculty proportionally. So this is not going away as faculty age, for example. Across time as we get cohorts turning over in our faculties. And then when it comes to actually, we looked at the interactions and we put all this into the regression model to predict those equity gaps. And the only thing that was predictive above and beyond faculty's racial, ethnic background, gender, time teaching was their faculty mindset. So that's some pretty good evidence. I think that's why it was accepted in a science journal that this is its own thing. Then when it comes to selection, in particular in that study, it was actually the population of the entire institution, looking at all of the STEM courses that were taught by these faculty. And this was all the faculty at this institution across time. So we don't have issues of selection because we have the population in the data. So that's another thing that that we have there. So we've and then in some of the other studies in the interventions, we've had whole departments come on board, regardless of whether their faculty want to sort of engage in this student experience project, so that we can actually look at among the willing versus the less willing, do we see that these practices are just as effective in shifting students' experiences and creating more equitable learning environments. So that is something that we're doing too at the intervention stage to deal with selection bias.
I see, makes sense. Sort of.
Thank you.
One more follow-up question. Again, another confounding factor that somebody pointed out. Did you control for grade inflation? That is it possible that growth mindset professors gave easier tests than fixed mindset professors? Perhaps it could be controlled by a standardized test across course sections?
Yes, we have looked at that when we drill down, and we're actually able to look at some disciplines like biology and computer science in particular, give particular exams across sections of their gateway courses. And so we can actually look at just performance in those particular subsets where we have those standardized performance outcomes, and we find the same kind of effects there. So, regardless, we've also done experimental studies where we actually show videos of faculty teaching from more of a fixed or more of a growth mindset from these actual videos we've created. And then we give people like GRE style performance tests, and we replicate the effects in those experimental contexts as well. So a couple different pieces of evidence that it's not about inflation or the growth mindset being more easy from the perspective of students that's causing the performance differences.
They're certainly fascinating results. Thank you for the answer.
Thank you.
Great. So the next question is for Sarah Rajtmajer. Sarah, how, in your presentation, how does the project consider various types of scholarship? For example, what is the diversity of the science and scientists involved in the construction of the models that your team is creating? For example, ethnographers are not typically striving for reproducibility, right? Rather, instead, they're optimizing for rich description and theory development, right? And this is quite different from the science that was discussed in your presentation. So what is the study population, if you will, that you consider?
In the development of the tools that evaluate the work, we're working from 30 journals, sort of top journals in the social and behavioral sciences. So our core set of papers is 60,000 papers, and we sort of are using those because the focus was to develop this tool for social and behavioral sciences, and also because in order to train our systems, we needed a lot of manually annotated data. So the other teams that are part of the program are actually going through those papers and annotating the claims that are being made in the abstract, and then throughout the text. So at this point, for that tool, we're focused on social and behavioral sciences, but we're not focused, and we have 10 sort of subject areas within social and behavioral sciences. So psychology and sociology and economics and political science and 6 more. And so we do have sort of that focus, and we're actually thinking to develop sort of separate agents that evaluate specific domains in some cases. But with respect to the NSF and CSES data and their survey, it isn't actually focused on any particular domain, and they make a very big effort to be sure to be over-inclusive of underrepresented populations, just in order to make sure that they're well represented. So you can see when you go to their website the size of the group that gets surveyed and the size of the population, but also how they stratify their sampling to make sure that the demographic are covered appropriately.
Thank you, Sarah. It's very exciting research, and we all look forward to see what the output of that is going to be in the years to come. The next question is for Adriane. Adriane, I was asked 2 questions, which both of them are sort of similar, so I'm going to paraphrase. How does your research team envision the data that you've been collecting, that you intend to collect, and the interventions that you're envisioning with the AIS to trickle down into the IS departments where P&T decisions are being made that will hopefully promote women to full professors? So how do you see that happen, that transition happening?
That's a great question. I think it speaks to the difficulty of making those changes at the institutional level, which is why we focused at the association level, where we could help provide evidence for leadership and notoriety in the field, which is part of the evaluation for women in the field and for all of us in our evaluation towards promotion and tenure. And in particular, towards that notoriety as a full professor, having regional, national, international presence. So that happens independently. So if we can provide that independent assessment that will go alongside the external letters and other evaluative measures that go in, hopefully we're helping someone create a stronger case.
Great, thank you. That makes sense. Great. The next question is for Payton. Faye, there were only 2 clarifying questions that were asked by Todd Price on the Q&A, and I'll ask both of them. Hopefully you can answer. So in your presentation, do the ICD-9 codes connect to any DSM-4 linkage? Is there any linkage there? And also, do you find any hospitals offering fresh food centers for patients, either discharge or community shopping?
Okay, so question 1 was about the Diagnostic and Statistical Manual. The Diagnostic and Statistical Manual for, particularly for mental health, that was first published in the early 50s, 1950s. What is interesting about that is that there were, at the time, only a little over 100 number of diagnoses as it relates to mental health. Fast forward to 2000, which is the period for which our data set covered, that had tripled. And what we did was we attempted to use reference back to that manual, but it was oftentimes very difficult to find when a particular mental health condition began to be utilized, because physicians can add those at discretion, right? And there's a process that they go through. So yes, we did try to reference that as much as possible. And the second being, we also saw the complications of just being able to say, we thought naively that we'd be able to say, find schizophrenia and just track schizophrenia. But what we find is the 1.1.1 and the 1.1.2a, and that's where we ran into the difficulty, which talks about in the data, it's not just enough to bring the data, it's the codification of these data and how do you sanitize that in order to make recommendations. And secondly, I think your question was about fresh food in community. Oh, well, there are a lot of public health. There are a lot of public health interventions and programs that are out there that are working towards making sure that this happened. But I can't tell you that when we ran our data set that we took a look at community at that level. And what I'm saying to you in our presentation, that in and of itself in our findings, that's where the shortcomings come in, right? I mean, we based our recommendations based on the data that we were provided, which is not in and of itself telling the whole story.
Makes sense.
Mm-hmm.
Thank you. So I guess now let's move on to the more interesting question, which hopefully elicits more discussion between all the panelists. This question is sent in by Rob Chiles. Hopefully I got your last name correctly. Please forgive me if I did not. How do we know that the quest for diversity-rich datasets that we are all engaged in isn't inadvertently creating a social credit system that could someday be used to further surveil, track, rank, score, and ultimately discipline our faculty, staff, and students? So if each one of you, has something to say, or anybody would like to go first about for this question, please feel free.
You said, how do we know? That's the question.
Right. How do we know, or rather, another way to think about it, how do we make sure that this does not happen?
Right. We don't know. I think that's the challenge, right? We don't know. So now what you have is, and I'll just say 2 things. You have now what's being called explainable AI, We need to take a step back. We need to take a step back, and we do need to look at explainable AI within the organizational context, in higher education while we're using some of these data and creating these data sets. But also, I think the other thing is that we need to make sure that we are using models that are out there that have humans into the loop from the beginning, not at the end, not the tail end of the process. And so I think these are some ways that we can, I would say, help to mitigate. But right now, we don't know, because explainable AI, quote unquote, is new. And the idea of human into the loop from the beginning, like participatory design research, is not fully implemented.
That's a great point. Any else would like to interject?
We're being cautious that we're not just going to ask all of the questions that we could possibly ask of the membership, because it's not necessarily all relevant. Just because we can ask it doesn't mean that we should. And that's where I made the statement about thinking more broadly, why? What is the charge for this effort? What do we want to discover and uncover to the benefit of our membership through what we're collecting in the data? So yes, we can get very granular, but we still have to keep sight of why would we ask that? And that's the best that I think we can do at this point.
Makes sense. Makes sense. I guess one comment that I had to your answer is, I think it would also matter how long do you store the data for? So you collect data from somebody, how long do you need to store it for? And if it is not needed anymore, are there effective mechanisms in place that allow you to make sure that data is discarded in a safe manner, in a privacy preserving manner? But yeah, I completely agree with the sentiment that you shared.
Yeah, one concern about discarding data, though, of course, is replicability over time. And it kind of is at odds with the need to be able to replicate the data. In fact, everyone's asking now for people to store their data on open access systems, right? With like open science networks and frameworks and things like that. So, I think that actually poses even more of a challenge when thinking about some of these concerns about privacy and that sort of thing, and having these data sets be available. I know National Science Foundation would like everything they fund to have the data stored online and accessible in these, repositories. And so that's a real challenge, I think, to everybody collecting these data. How do you thread that needle so that privacy is ensured?
So thank you for that answer. Another perspective, or as part of another question is this question about making sure that we don't do more harm as opposed to more good, which is all of our intentions. Is it only us as researchers that have to take the entire burden, or is it the case that government policy, like the European GDPR, does that have a role to play, and how big of a role does that have to play in ensuring that whatever systems we make, whatever data we collect, that gets used in a responsible manner?
Yeah. So there. Oh, was someone else going to?
No. Go for
okay.
it. Go for it. Yeah.
No, I don't think that we as academics are the only players here, right? I mean, there are corporate responsibilities. I mean, you take a look at the data that Facebook gathers, or Twitter, or any social media giant. When I think about the data that healthcare organizations have, I mean, they have HIPAA, right? HIPAA came down because of this very concept, but not knowing that it was going to explode, data was going to explode at the rate that it has. And so taking a look at those models in other different industries, as well as in other different countries, but now then you begin to run into what may work in the UK may not necessarily work in the US context. Exactly. But it needs to be a full-blown responsibility, I feel, from stakeholders within the community. This is not just about academics. I think one thing that we have not touched upon is this, the responsibility that we have as citizen scientists, more of a place where citizens are actually wanting to curate their own data. And what does that mean for the process as well? And who will be able to act?
Great. Thank you, Pay, for that wonderful answer. Let's move on. We have 4 minutes. Jenni, am I correct? Okay, so I guess we have 4 minutes. Let's try to get in one final question. I guess, to end, there are several questions, by the way, for all panelists on the Q&A. So please, if you do get the time, please try to answer them. There's one for Sarah and there's one for Mary. I guess I would like to end by asking all of you a very short response on what do you think the future holds for us? How do you envision data and AI, data science and AI being used to ensure diversity and inclusion inside academia? What can we, all of us as researchers, do to make sure that we move towards this future that we all want to move towards? What can be steps that we take? Would anybody like to answer?
I can start. I think that the only thing that algorithms and models and big data can tell us is about the past, right? And so that's a huge problem when we look at historical traces of anything, and then we try to project. I think that that's always a worry, that we'll be projecting forward a lot of the things that were bad. So what I see, at least with respect to some of the work that I've been doing, is that we're just trying to uncover what's been going on. We're trying to uncover, and like there's some great questions for me in the chat about bias and citation bias, and it's actually a big motivator of what we're doing, because I don't think that citations are necessarily the best measure of academic success and output and value. And I think that's agreed upon, but nobody knows what to replace it with. So what I'm hoping is that, new advances with big data and AI can give us opportunities to both like make more transparent some of the transgressions of the past, and allow us to really look at them and critically, and then give us opportunities for some creative ways of evaluating success. And that means scholarly success. It means success in initiatives for inclusion and equity moving forward, so that we can stop looking at these old metrics that seem to be full of so much bias.
Great. Thank you, Sarah. Adriane, would you like to go next?
I take your question as what are the takeaways?
Yeah.
And I see it as an emphasis on effort and being able to raise to consciousness what is happening for folks. I mean, we talk about implicit bias, even taking it to a cognitive neuroscience standpoint. We can't deal with anything unless we know consciously what it is. We cannot create new habits, new ways of behavior and being without raising it to consciousness. So we first have to get to what is that thinking driving our behavior. And so we can do that through training, as well as looking at novel approaches to technology and how we're gathering data. And that can help provide new insights.
Great point. Thank you.
I think building on that point, I would just say that, one of the things I see here, different from what I heard yesterday when I was listening into some of the sessions, is really a focus on power and a focus on who is creating these data and who are the levers of change that we should be focused on. So much of this work has been focused on the individual student. Even past mindset work has focused on what's wrong with students' mindsets when the system was not created for them. And it's become a blame game, same with grit, for example. And so, really focusing on at the level of the institution, of the powerful actors in institutions, and at the faculty level, at the context level, I think is really what I've seen as a takeaway from this session. Multiple talks seem to be focused at that level.
Thank you, Mary. Faye?
Mary, pretty close to my heart and my thinking there. But I will say, as I put in one of my slides, this is about structural levers of power. I think you asked the question is how will we get there? And you said that the future how do we get to our agreed upon future? I don't know that we've agreed upon what the future looks like because we haven't pulled marginalized voices at the table and all players and stakeholders at the table. So before we know where we're going, we need to agree upon what is that future state. I do believe that whatever the future will hold, it needs to be interdisciplinary. And this disciplinary elitism, that certain disciplines are more valued in this data science game, is a misnomer. And because certain disciplines will miss context. And when you miss context, you overfit and underfit. And in the context of other places like healthcare, that means someone is not getting care or the care that they needed, or someone is being overlooked. And this idea of fairness has to be decided upon who sits around that table.
Great.
That's it.
That's a great way to end this panel discussion. Thank you so much, Faye. Thank you so much to all the panelists for all the wonderful points that you've raised. Attendees, thank you so much for attending. I know you can't clap because you're not inside the Zoom room, but please join me in thanking all the panelists for all their wonderful presentations throughout the day and for this for their points and their arguments during this panel discussion. This certainly was a very compelling 2-day symposium that casted an eye towards a future we all know is coming, and in some respects is already here. And we should, we should be trying our best to prepare for it. Clearly, data science and AI will contribute somehow to a new future in diversity, equity, and inclusion. And hopefully, we are all now better prepared and better informed about the promise and peril of this. With that, I'm going to bring this to an end. Thank you so much for attending. Thank you so much for the panelists for presenting. And we hope to see you soon.